Good morning and welcome to our Every Move Counts webinar to mark the publication of the National Physical Activity and Sedentary Behaviour Guidelines for Ireland. I'm Sarah O'Brien, National Lead with the Healthy Eating Active Living programme here in the HSE. I work as part of the HSE Health and Wellbeing section, and we work closely with colleagues in the Department of Health, in the wider health services, other public agencies, as well as community and voluntary partners to support the implementation of the Healthy Ireland framework. The Healthy Ireland framework, as many of you will know, is a cross-government framework to improve health and wellbeing across our population and prevent chronic disease. Today, we're putting the focus firmly on the area of physical activity, and we're delighted to have so many of you joining us from across the country and from different sectors: health, education, sport and community. We will have a questions channel open as the webinar progresses, so do please put any questions you have or comments into it. Due to the high numbers of people joining us online, we won't be able to take individual questions, but we will endeavour to ensure that the themes coming through in your questions are raised and discussed with our panel later on. The webinar is being recorded, so we will send you an email afterwards with a link for any of you who want to listen back. Our hashtag today is hashtag Every Move Counts, so do please use it when sharing or commenting or communicating online. Today is the culmination of a collaboration between the HSE, the Department of Health, and a research team led by Professor Elaine Murtagh from University of Limerick. So I'm very pleased to have the Chief Medical Officer, Dr. Breda Smyth, as well as members of the research team here with us today as we launch the new guidelines. But first, a few words from Minister of State for Public Health and Wellbeing and the National Drug Strategy, Ms. Hildegarde Naughton.
I'm very pleased to have this opportunity to welcome the launch of Every Move Counts, the newly updated guidelines for physical activity and sedentary behaviour in Ireland. I strongly believe that these will play a strong role in supporting the efforts of policymakers and practitioners to improve the health and well-being of the people of Ireland through physical activity. Promoting physical activity for health is a key part of my responsibility as Minister for Public Health and Wellbeing. My department supports a broad range of initiatives in this regard, both in its own right and by working across sectors. The benefits of physical activity are clear across all stages of the life cycle, and promoting physical activity requires a tailored approach for each age group. These new guidelines are informed by updates at domestic and international levels and are supported by the incorporation for the first time of guidance in relation to sedentary behaviour. Limiting sedentary behaviour and participating in physical activity are key aspects to the promotion of health and well-being across our population. These guidelines are a valuable tool for health professionals and practitioners and will be hugely important as we continue to develop and refine the policies that will remove the barriers and promote physical activity. Today's event ensures that our efforts in this regard are informed by the best available evidence. I'm sorry that I can't be there in person today, but I really want to congratulate all involved in the development of these revised guidelines. I recognise the volume of research and collaborative work that went into their drafting and trust that they will underpin efforts by a broad range of stakeholders as we continue to refine our policies and advice to ensure the good health of our population. Thank you all for your dedication and commitment.
Thank you, Minister Naughton. So now I'd like to welcome to the podium Dr. Breda Smyth, our Chief Medical Officer at the Department of Health, to share a few words with us.
Good morning, everyone, and thank you for the invitation to participate at today's launch. These guidelines are the latest step on a journey that began with a commitment in the Healthy Ireland Framework and Strategic Action Plan to develop a plan to promote physical activity. So why is physical activity important? Well, physical activity is important because it's good for our health. It reduces the risk of cardiovascular disease, obesity, some cancers, but also increases our mental health and well-being. So it has a global effect on our health. So these guidelines place evidence-based physical activity at the heart of coordinated action by the range of sectors on the NNAP implementation group. And this group is co-chaired by the department by my department and the Department of Tourism. We are supported by departments of Education, Children and Local Government, along with Sport Ireland, HSE, Federation of Irish Sport, Local Government Management Agency and the academic sector. This cross-sectoral approach is critical to ensuring coherent, joined-up thinking and oversight at a local, national and regional level. All of us here today are looking to support physical activity, and it's the understanding of best practice. And this is why it is so important that we now have updated guidelines. This morning's panel discussion will delve into the role that these guidelines for physical activity and sedentary behaviour will play, and I very much look forward to hearing its outcome. For the first time, as the Minister has outlined, the guidelines include specific recommendations in relation to small children, including infants. In addition, the development of sedentary behaviour guidelines adds another string to our bow. They reflect our changing lifestyles and the growing influence of technology that have fueled sedentary behaviours. Currently now, we know that in Ireland, people spend at least 5 hours a day with sedentary behaviour. So every move really counts. And this is particularly apt for the guidelines that we are launching here today. Within my department's policy role, we are keenly aware of the importance of encouraging our population to start on a pathway to physical activity, as well as supporting those already on this pathway to becoming more physically active. We know from surveys that a lot of Irish people are active, and walking for recreation is the most popular form of physical activity, with 68% of the adult population participating regularly. Surveys also tell us that the active proportion of our population are getting more active or getting active for longer over the last decade. And this information is backed up by our own Healthy Ireland survey. I see a particular benefit to policymakers arising from these guidelines being launched today. The disaggregated guidelines for different population cohorts, in particular young people, is hugely important in developing targeted interventions in assessing their effectiveness. We must also continue to collaborate to consider how physical activity can be continued and also considered in urban planning, transport planning, community development and other areas. And our new guidelines will prove invaluable in furthering this work. So physical activity is really important, and these guidelines are a really helpful tool to help our health professionals guide our population to increase their physical activity, and for those that are not already participating in physical activity to engage in physical activity. I want to thank everyone who was involved in the development of these guidelines. Every move counts, and look forward to working with many of you as we integrate the guidelines into our work going forward. Thank you.
Thank you, Dr. Smyth. We greatly appreciate your time and support throughout the process of developing these guidelines. You very kindly chaired the consensus meeting we had in November. I'm now going to invite Professor Elaine Murtagh from the Department of Physical Education and Sports Science at the University of Limerick. Elaine's research interests are in the areas of physical activity, physical education, and the effect of physical activity on health. And Elaine has ably led a really distinguished research team to develop the new National Physical Activity and Sedentary Behaviour Guidelines for Ireland.
Thank you, Sarah. I'm delighted to present this work on behalf of my colleagues listed on this slide. We undertook this research project throughout autumn 2023 to update the National Physical Activity Guidelines for Ireland. As many of you will be aware, The last physical activity guidelines for Ireland were published in 2009. And since that time, evidence has evolved. And therefore, it was timely that Ireland reviewed and updated its own guidelines last year. This echoes global developments as the World Health Organization, or the WHO, published new guidelines in 2019 and 2020 for physical activity and sedentary behaviour from children under 5 right through to older adults. As part of this project, we were tasked with producing both guidelines and messages. Guidelines are recommendations based on scientific evidence, written for professionals and practitioners like yourselves who have a role in promoting physical activity. Messages translate these guidelines for wider use. These include lay summaries or plain language versions of the guidelines for the general public, messages to motivate people to be more physically active, and educational material for professionals and practitioners working to promote physical activity. I'll firstly provide an overview of the research process we undertook, and then I'll present the new guidelines for Ireland. We adopted this 3-stage process when undertaking this research, involving a desktop review, expert meetings, and stakeholder consultation. And for both the guidelines and the messages, we considered these 6 population subgroups, including children, adolescents, adults, older adults, including those living with disability. In stage 1, a desktop review of evidence was conducted to identify and examine literature published since the 2020 World Health Organization guidelines on physical activity and sedentary behaviour. We were particularly interested in discrepancies between our former 2009 guidelines and the newer 2020 WHO guidelines. We also looked for systematic reviews that were published since the literature review that was conducted for the WHO guidelines, so that we would consider any new evidence. And we were also interested in any adaptations of the global guidelines by other countries. Evidence briefs were then published for each population subgroup, along with a recommendation on whether the 2020 World Health Organization guidelines or an adaptation of them were applicable for the Irish context. And at this point, it was clear that in addition to physical activity, the new guidelines for Ireland should also include guidance on sedentary behaviour, as evidence had accumulated since 2009. In stage 2, a meeting of the research team reviewed the evidence briefs and proposed draft physical activity and sedentary behaviour guidelines for Ireland. Led by Dr. Chloe Williamson from the University of Edinburgh, and using her physical activity messaging framework, we also considered messages for each population subgroup. And remember, these are lay summaries of the guidelines and also persuasive or motivational messages. We also used the UK CMO Physical Activity Guidelines Communications Framework to produce messages for professionals and practitioners in order to support them in their work promoting physical activity. Then in stage 3, we engaged in a stakeholder consultation to gain feedback on the draft guidelines and messages. We conducted an online survey for the general public and a survey for professionals and practitioners. This gave us feedback on whether the text was clearly stated and relevant, and it also highlighted areas that might need further explanation. One, for example, was how physical activity intensity is described in the guidelines. A consensus meeting was then held with stakeholders from a range of sectors, including education, health, sport, and so on, to gain further feedback on the issues that were raised from those surveys. This consultation group also advised on what content needed to be featured in the final guidelines publication so that it was relevant and useful for those who are working to promote physical activity. I will now share the new physical activity and sedentary behaviour guidelines for each population subgroup with you. It's worth remembering that guidelines are written for those who have a role in promoting physical activity. They're not written for the general public. That's what we have the messages for, and I'll come to them. So the guidelines would be written, for example, for policymakers or practitioners working in health, education, youth, and so on, or NGOs, private sector, research, healthcare. So let's start with children under 5 years of age. Children less than 1 year should be physically active several times a day in a variety of ways, particularly through interactive floor-based play. More is better. For young babies not yet mobile, this includes at least 30 minutes of tummy time spread throughout the day while they're awake. For children aged 1 to 4, they should spend at least 3 hours in a variety of types of physical activities at any intensity spread throughout the day, including moderate to vigorous intensity physical activity. For children aged 3 to 4, at least 1 hour should be moderate to vigorous intensity. The new guidelines also have recommendations for sedentary time, and sedentary time should be limited for under 5s. This means that infants and children should not be secured in a pram or a high chair, for example, for more than 1 hour at a time, and should not sit for extended periods of time. Sedentary screen time, so that means watching TV, videos, playing online games. This is not recommended for children aged 1 and under. For children aged 2 to 4, sedentary screen time should be no more than 1 hour a day, but less is better. Next, we look at guidelines for children and adolescents aged 5 to 17 years. These children and adolescents should do at least an average of 1 hour per day of moderate to vigorous intensity, mostly aerobic physical activity across the week. Vigorous intensity, as well as activities that would strengthen muscle and bone, should be incorporated on at least 3 days. And the guidelines acknowledge that for some children and adolescents with certain disabilities, a reduced level of physical activity is adequate to attain the health benefits, considering their higher energy cost of physical activity. The guidelines also recommend that children and adolescents should limit the amount of time spent being sedentary, particularly the amount of recreational screen time. Now we move to adults, older adults, including those living with disability. Adults should do at least 2.5 hours to 5 hours of moderate intensity aerobic physical activity throughout the week. Or you can spend half as much time doing vigorous intensity physical activity. So that would be 1 hour and 15 minutes to 2.5 hours throughout the week. Adults should also do muscle strengthening activities at moderate or greater intensity that involves all the major muscle groups on 2 or more days of the week. There is an additional recommendation for older adults, including those living with disability. And as part of their weekly physical activity, older adults should do varied multi-component physical activity that emphasises functional balance and strength training at moderate or greater intensity on 3 or more days a week. And this is to enhance functional capacity and to prevent falls. All adults may increase moderate intensity or vigorous intensity physical activity to do more than the recommended amount for additional health benefits. So that's more than 5 hours of moderate intensity or more than 2.5 hours of vigorous intensity physical activity. We also have a sedentary time recommendation for adults, including those aged 18 to 64, 65 plus, and those living with disability. Adults should limit the amount of time spent being sedentary. Replacing sedentary time with physical activity of any intensity, including light intensity, produces health benefits. And to help to reduce the detrimental effects of high levels of sedentary behaviour on health, adults should aim to do more than the recommended levels of moderate to vigorous intensity physical activity. So for every guideline that I have presented so far, there is an associated message that gives a lay summary of the content. There is also a suite of motivational messages for each population subgroup. These are all included in the guidelines publication, available for download from the Department of Health website. Here is a sample message for adults, stating you can improve your mental and physical health by taking part in at least 2 hours and 30 minutes of moderate intensity physical activity, such as brisk walking, or at least 1 hour and 15 minutes of vigorous intensity physical activity, such as running per week. You'll notice that the message is written in a more concise manner than the recommendations I've already presented, and that examples of activities are included in the message. I'll share the message relating to muscle strengthening activity also. It reads, taking part in activities that strengthen your muscles, such as resistance training or yoga, on 2 or more days each week brings important health benefits. The second message on the screen aims to improve perceptions, attitudes, and motivation to be physically active. This one states, move your body and be active in a way that you enjoy. Any physical activity is good physical activity. The guidelines publication includes a bank of over 100 messages that professionals and practitioners can select from and use in their roles when promoting physical activity. We expect these messages will be helpful for those undertaking this task when communicating the new guidelines or for use in communication campaigns. This last set of messages are written as educational material for professionals and practitioners. This sample that I have on the slide is aimed at those working in education and childcare. It states, regular physical activity is associated with improved learning and attainment, both directly through improved grades, school engagement, behaviour and reduced absenteeism, and indirectly by enhancing skills such as self-control and concentration, team working and management and time management. Message sets have also been developed for those working in health and social care, physical activity and sport, and local authority. And these are all included in the guidelines publication. Finally, the publication includes examples of what might be considered moderate, vigorous, and muscle strengthening activity, as shown in the table. For children, moderate intensity physical activity would be activities like throwing and catching a frisbee or taking part in physical education class. Vigorous intensity would include playing tag or skipping using a jump rope. Muscle strengthening could be climbing a tree or a climbing frame. For adults, moderate intensity includes brisk walking, gardening, or golf. Vigorous intensity is running, swimming, or martial arts. And muscle strengthening could include lifting weights, resistance training classes, or heavy gardening. We hope these tables will help translate the recommended intensity of physical activity into meaningful examples. The new physical activity and sedentary behaviour guidelines and the associated messages are now available in this publication entitled Every Move Counts. The title reflects the overall tagline for the new guidelines, reminding us to be physically active in a way that we enjoy and as often as possible. Thank you.
Thank you, Elaine, for that really detailed overview of the process to develop the guidelines and the new guidelines themselves. I suppose it's great that we have now guidelines that speak to so many different groups in the population, because it's really important for us that people see themselves in these guidelines as much as possible, because very much, I suppose, the key message from today and from our new guidelines is every move counts. So we are encouraging everybody, particularly those who are not very active at the moment, to think about it and become more active, to move every day and to really aim to get that minimum of at least 2.5 hours physical activity in across the week and some muscle strengthening. There's quite a lot of detail in what Elaine went through there with you. So I'm really delighted to have Elaine, as well as two other colleagues from the research team, Dr. Sean Healy from the University of Limerick and Professor Charlie Foster from the RCSI and Bristol University, as well as Colin O'Hare from the Department of Health, join me here on a panel where we can discuss the detail of those guidelines a little bit more. And we've had some really nice questions coming in from the audience as the presentation was going on. So hopefully I'll be able to translate those into questions and get the answers for you from the panel. But if you have any more questions as the panel discussion is going on, they'll all put them into the chat and we'll pick them up. So I suppose one of the pieces that is particularly new in these guidelines, and Minister Naughton and Dr. Smyth referred to it, is the Sedentary Behaviour guidelines and that whole concept of every move counts. So I might just ask the panel in the first instance, why and where did they come from? And it's quite a broad recommendation, isn't it, compared with some of the other recommendations?
Thank you. Everyone's looking at me, so I think that's my answer. So hi. Look, every movement does count. And when physical activity guidelines were first constructed, we knew that the movement part was the bit that gave everyone health benefits. And since the last 10, 15 years, we're discovering that actually the not moving part is equally powerful when it comes to driving poor health. So within the guidelines, you'll find lots of good reasons why breaking up sedentary time is really important. Making sure that you're breaking them up, make sure you're not sitting or being still for long periods of time, because those also have subsequent sort of health benefits as well. So the movement part is obviously the thing you need to replace the sitting with. And we want to try and make sure that people are recognizing that not moving is not very good for you. So there's lots of benefits from breaking that up and trying to make sure you increase your physical activity time. So sedentary behaviours joined the physical activity party, but isn't the most popular person because that's the movement part.
So, and I suppose, Charlie, it's more, move every day. We're not talking about blocks of time or anything like that. It's very flexible.
Yeah, we haven't got the granularity when it comes to the science to be able to give a precise amount of sitting time above and which below is particularly dangerous. We just want people to be conscious if they haven't moved, they need to. It's rather ironic. We spent the whole morning sitting down, listening to a physical activity presentation, and I'm itching to kind of get myself standing up and stretch my legs in a moment. So just break it up. That's what we're after.
Great. And Elaine, the other piece that people might see a little bit different in these guidelines are the recommendations around muscle strengthening. Now, I know they were always there in 2009, but maybe they're a little bit stronger or more on a par. What are we talking about that? Do we all need to suddenly get gym memberships?
Well, if you have a gym membership and you go, I would say keep going. But there's lots of other ways you can include muscle strengthening. So some people at home like to do online exercise classes or use resistance bands or do their own yoga. But also there's some activities that you do every day that would strengthen your muscle. If you're doing heavy gardening, if you're lifting heavy shopping bags, repeatedly lifting young children, that's also muscle strengthening activity. If you haven't done any, or if you're muscle strengthening activity before, or if you're an older adult, even repetitively standing up and down from a chair can be muscle strengthening, or when you're standing, raising up on the balls of your feet repeatedly. So there's lots of different ways that we can strengthen our muscles. The key, if you want an indicator of if you are engaging in muscle strengthening activity, is that your muscles actually feel a bit tired. And when it's greater than moderate, then probably even shake a little bit. But even if you feel that your muscles are a little bit tired, then you're doing muscle strengthening activity.
Okay. So a key is for us just to be aware of that and to kind of build it into what we're doing.
Exactly. And I often the focus is on the amount of time engaging in general physical activity. We just don't want people to forget that they also need to think about strengthening their muscles too.
And for children and young people, is that a particular message that we want to?
Absolutely. And often children will engage in muscle strengthening activity without us needing to label it like that. So if you see them pulling something, climbing on something, that's muscle strengthening activity. A climbing frame, a tree, things in the playground, that's all muscle strengthening activity.
Okay. That's it's because sometimes when we think about muscle strengthening activity, we go automatically to gyms and weights and different pieces. So it's very much about kind of moving our body as a whole and thinking about it that way. So I suppose, also the guidelines are so we have them for different population groups. So children, adolescents, babies, adults, older adults, people with disabilities. And I suppose when you were looking at the evidence and looking at the guidelines and developing the guidelines, particularly in relation to people living with disabilities, was there anything in particular you needed to consider or look at?
Yeah, so that was one of the early decisions we had to make in this process was how to include people with disabilities and how to represent people with disabilities in the guidelines. And there's a variety of ways we could have done that. Ultimately, we opted for specific guidelines for persons living with disabilities, as we felt just raising the awareness that people with disabilities have the right, have the ability to enjoy and benefit from physical activity was worth it. And we followed the work there of the World Health Organization, the UK new guidelines specifically for people with disabilities, and various other countries who have adopted this type of process as well. Again, one of the main benefits is that it is raising awareness that these individuals can safely, enjoyably benefit from physical activity just like everybody else. We're also aware, I suppose, from the start that straight away when you mention people with disabilities, it's a very, very diverse group. It represents a lot of different Irish citizens, for example. But ultimately, that's what we decided to do, and we adopted, for the most part, World Health Organization guidelines for persons living with a disability, but informed by some of the work recently done in the UK, where they identified that for some subgroups of people with disabilities, maybe they get the same benefits with a little bit less physical activity if their disability might reduce the efficiency of movement. Basically, that's what it came down to. So we did have that little caveat, but otherwise we are recommending that children living with a disability and adults living with a disability, they should strive for, and they have the capability to strive for, the physical activity guidelines just like everybody else. And yeah, so we think what is in there now, it will hopefully raise awareness out there, and we think it's as true to the data as possible. So yeah, that was a big change in the new guidelines.
And I know, Sean, that there's some discussion and debate in terms of how we use language and terminology in terms of people living with disability. And I suppose for these guidelines, we've chosen to use the term people living with disability, but recognising that, as you said, it's a very diverse group, different sectors or different sectors within it will have different perspectives around it. But one of the things that was really interesting in looking at some of that was this concept of, it's not always the person, it's the environment.
Yeah.
So are there things we need to be looking at?
It's definitely something we need to keep looking at and keep talking about, because it's a conversation that evolves over time. And like you alluded to there, there's definitely going to be disagreement about how people like to be referred to. That's very natural. Broadly speaking, you can kind of go the person first language, which is what is ultimately reflected in our guidelines, or identity first language. And our National Disability Authority, they actually recognise the benefits of both, and they kind of use them interchangeably, which I think is kind of wise, because you're somewhat responding to different preferences in Ireland. But we ultimately went for the language, the terminology that is generally used by the HSE when referring to people with disabilities or people living with disability. But I think it's great to recognise that this is quite different in other countries like the UK to talk about disabled people, because that's how disabled people in the UK prefer to be referred to as, generally speaking, because they recognise, or they are of the belief that it is the environment that is disabling them. So it's a more kind of social model of disability. So I think it's something that, as these guidelines in Ireland evolve, I think it's a conversation we have to keep having. And of course, we have to keep going back to our stakeholder groups as well and hearing their perspective on how a language should be used surrounding disability.
And I suppose just picking up on that piece there, Sean, around the environment disabling us as a whole. I know, Elaine, in the guidelines, there are messages for health professionals, for people working in education, for people working in local authorities, which is unusual to find. Do you want to say something about that?
Yeah. I suppose what's unique about the Ireland guidelines is that we've considered how they're going to be used by those working to promote physical activity. And often the guidelines, when you read scientific guidelines, they can be quite confusing. So within this document, what's unique for what we've done is that we include messages that have translated the guidelines for a range of groups, and we've included those educational messages for various sectors. So they serve to highlight the benefits of physical activity and make sure people are aware about why the guidelines are important and why we need to be physically active.
Yeah. And I see, like, for the local authority, probably in particular, talking about, accessible, universally accessible play spaces, parks, communities and stuff like that. So I suppose those are the kind of things we're talking about in terms of enabling everyone in the population to be active. Colin, can I come to you? National Physical Activity Guidelines, where do they sit in terms of the policy landscape? I know Dr. Breda Smyth spoke a little bit to it earlier, but, in terms of the new, our future National Physical Activity plan and framework.
Thanks, Sarah. I think to a certain extent we've kind of touched on this as a panel already. I think that when you talk about enabling, facilitating physical activity, you're looking at, like you said, the education sector, healthcare sector, the local authority sector. And I think these guidelines are invaluable in terms of providing policymakers or people within each of those sectors who maybe look at this kind of thing from their own focus. It gives them that broader, more holistic piece of where do I fit in that broader jigsaw. So we would have had our first National Physical Activity Plan in 2016. And I think Dr. Smyth spoke about the wide range of participation we have there. And it's that cross-sectoral piece you need if you're going to crack the nut of removing the barriers to physical activity. So we would have seen the role of the guidance at that stage in terms of helping policymakers to design policies that are informed by, the best practice and at the time. And as that has evolved, I think there's a huge role for these new guidelines in that piece. But I suppose the key is that you will have, you talked about parks, there's not just this, where is the park, what amenities are in the park, there's accessibility of the park. How do you get to the park? How do you look at that side of things? And then how do you provide people with information on what should they do when they get there? I think we've all seen there's a lot of parks there that have physical activity equipment in them. And that's another, a progression in that space. So the role of the guidelines, I guess, is to sit within national policy as the tool to inform each of the policymakers to make sure that what they're doing is coherent with each other and that it's joined up with that.
And I suppose a particular question has come in on the online. Sure. It's in relation to implementation. Yeah. Is there an implementation plan behind these guidelines?
Yeah,
that's probably something you're working on.
Yeah, it's timely, I suppose. Like I said, the first physical activity plan came out in 2016 and it had, I think, 60 actions in it. And we did an independent review in 2020, which found that the vast majority of those were done or were in the process of being done. And what we're doing now is we're building on that. So we're building a successor to that plan, and we've got that cross-sectoral implementation group, which ensures that we have the different stakeholders who have a role in making sure that what they're doing is coherent with what everyone else is doing, and vice versa. So at the moment we're finalising that. We're looking at having, I suppose, a long-term framework that will guide that coherent approach, and that'll be delivered then through a series of action plans. We're hoping to have that launched by the end of Q2 of this year. So it's timely to have these guidelines out and to ensure that we're basing what we're looking for and that type of coherence on the best available science and guidance.
And that implementation plan will look at areas like workplaces, schools.
Yeah, it's that whole of society piece. Like I said, if you look at the barriers to physical activity, it needs joined up thinking. You can look at where your active travel routes are. You can look at what's at the other end of them and how you link up the accessibility, the equitability piece of, is everyone in Ireland equipped with the opportunity to be physically active? And if they're not, why not? And what do we need to do to build that? So it's going to be that cross-sectoral approach, and it's going to be the joined up thinking over an extended period of time, that as you develop these local amenities, that they're not relying on households with 2 cars so somebody can drop their kid to that twice a week or whatever, because that doesn't work for everyone in Ireland. So it's the joined up piece of, how do you ensure that the local service provision is informed by the need. For example, Get Ireland Active, the new online digital database of all the amenities in the country. That's a huge tool so that policymakers in the sports facilities or local authorities or the health sector are aware of what is there in their area. And indeed, even if people are reading these guidelines and saying, I think I might try getting physically active, what's in my area? They can go to Get Ireland Active and they can see there are options that work for them in their area. So I suppose that's an example of the type of cross-sectoral buy-in where you need everybody to build something like that. And what we're hoping is in the years going forward that that'll be the approach all the stakeholders take, that we're all acting based on each other's, that coherent approach of what we need to do together.
So that kind of sense of it's the sum of the parts are greater than
precisely
the individual.
Yes, exactly.
Yeah. Great, thanks, Colin. And one of the pieces, and I know was a question at the consensus meeting in relation to the inclusion of messages around screen time in the guidelines. So not necessarily guidelines around screen time, but messages around reducing the amount of time spending screen. Why would, in particular, would that included?
So screen time again is connected to this sort of the not moving part. And it was recreational screen time. We're not saying do not do homework. We are saying do homework. Homework's really important. Recreational screen times is just an anchor that people will have to keep them sitting still. And what we're trying to do is try and reduce that amount of screen time, make it appropriate for ages, depending on under 5 children, young people, and encourage people that if they're being active on a screen, they're not being active. They need to kind of break this up and try and reduce their sedentary behaviour. We're not against screen time, and actually we have a competing world of increasing entertainment on screen time. We need to acknowledge that. So perhaps when the ads are on TV, get up, go and make a cup of tea, just go and do the washing up, do something, just break up that sitting time, because all those little chunks of activity really count, because every move does count. And I suppose just talking about screen time and different media, the audience are wondering how the guidelines are going to be communicated to the public. This is a little bit off that, maybe not directly to the public at large, but Colin, I think in terms of some of that work, that cross-sectoral work.
Yeah, I suppose this is where there's a role for all the different stakeholders in, and I think the guidelines are designed for a diverse range of stakeholders. There's a role in there for the messages that were developed for each stakeholder group to, there's a responsibility on our education system, on our transport system, on our sports and facilities, on our local authorities. There's a responsibility on all of these sectors to promote physical activity and the benefits of it. And I suppose, the sedentary behaviour angle as well. I'd kind of see that as much as, with Healthy Ireland and the Department of Health, we'll do our utmost to raise awareness of what's in the guidelines, and we'll incorporate them into policy development. And through the physical activity implementation group, all of our stakeholders will incorporate them into their policies. But beyond that, there's a responsibility on all of those sectors to raise awareness of the importance of physical activity. I think there's a kind of a sea change role to this piece of a kind of embedding it into the daily routine of everyone in our society. And that calls on, there isn't one stakeholder that can crack this. And this is probably coming back to why it required that cross-sectoral approach and why the guidelines themselves are built for that.
So yeah, it's like everybody saying the same thing, which is why that really nice to see the very clear every move counts message and the knowledge messages, as well as the enabling and motivational messaging developed as part of the guidelines. And in developing those messages, you did some testing with the public, and that?
Yeah, so it was important that the messages that are included did actually land well with the public. And in fact, we got some very helpful, by and large, there was, people did think it was relevant, it was clear, it meant something to them. But we did get some important feedback around making sure that the messages that are included are not too judgmental. So, because we recognise, some of the sedentary behaviour guidelines can be challenging, and certainly screen time has kind of become normalised for young children. So we recognise that that's a challenging space for parents. So that kind of feedback came through in the survey. So that helped us consider the language in the messages so that they weren't too judgmental, they're supportive. We recognise that parents are genuine in doing their best and want the best for their children. So we hope that the messages that we've now included will then help, say, childcare workers, social care workers, anyone in a role, healthcare providers in a role that are interacting with parents of young children to communicate the guidelines in a respectful manner.
Okay. And when we're talking about the guidelines and talking about kind of key messages and that, sometimes the questions get, well, what should I do? What's good to do? What will give me the most benefit, or what will give me the results the quickest? Is there any particular type of activity that we should be looking at doing more of, or is any one activity better than the other?
Well, I would say the best activity to do is the one that you enjoy and you will keep doing, because it'll be different for everybody. We don't all like doing the same things. So the key thing is to find something that you like and continue to do it. So as the tables I included at the end of the presentation gave examples of different moderate intensity and vigorous intensity physical activities. So you want to, raising your heart rate. For moderate intensity, you can still talk, but you probably can't sing. If you're doing vigorous intensity, you wouldn't be able to sing or probably talk for a long period of time. So using that talk test, find activities that you like. That's key. It's not that we're not in a position to say, oh, this is better than this. There's a wide array of options there available to people. It's about what you like doing and what you can include in your day. So for some people, they might be in a position where they can walk to work, and that's brilliant because they're commuting and they're getting their activity in at the same time. Other people, depending on where they live, might have a set time in the day where they're going to a class, for example, or others might just be walking the dog or being active with their children. So it's a case of finding the thing that you like to do, that you can include in your lifestyle, and it becomes the norm. That really is the key.
So essentially, we don't care what you do, just do something.
Yeah.
Move, as Charlie said, but also then look at how you can build other activities in at a regular basis. Charlie, the guidelines, I was saying, we have guidelines for various different groups, and we want everybody to see themselves in the guidelines. But I suppose when you look at these guidelines and compare them with the World Health Organization guidelines, there is kind of one or two groups that aren't currently referenced in it. So pregnant and postpartum women and people living with chronic disease. What would the general recommendations for those groups?
So, of course, with public health guidelines, it's sort of throwing a blanket over everybody and it will stick. With those particular populations, pregnancy and postpartum and chronic disease, there is a little bit of a nuance there. And a lot of people online will be working with these groups already. And they'll know there are particular conditions, that there might be one or two issues you have to tweak the right physical activity message. And also decide, is physical activity and exercise part of someone's therapy? So part of their kind of treatment pathway, or is it the thing they're going to do afterwards to kind of keep away the kind of the problems of that particular disease or condition? And those two things need a little bit more consideration. We want to engage more broadly with our supportive colleagues in the healthcare and medical system as well, to make sure that we're hearing their voice about what's the best thing to construct. So at this point, we decided, let's go across the whole of life course, include everybody, and then we can focus more on those on postpartum pregnancy and chronic conditions in the next phase. He says, staring at the HSE.
So more work to be done.
I hope so.
In that area. I suppose in general, if people are living well in the community with chronic disease, the guidelines that we're talking about today.
Absolutely. And there's no reason why people can't do it. And, living with a chronic disease is probably most of our population over a certain amount of time, a certain amount of age group. Most people won't have one condition. They'll have a number of them bunched together. It doesn't matter. If you can find something that makes you smile, if you can find something that makes you joyful, that's the one to be going for. If it's going for a chat and a blather with your neighbour down the front, that's fine. That's what you should be doing, all right? I want people to take physical activity regularly, not seriously. That's what I want them to do, all right? Because every move does matter.
Yeah, Okay. And I know we've just had some questions in there online in terms of where people can find the guidelines. So the guidelines themselves are on the Department of Health website. The link has been put into the chat there. But equally, if you just Google National Physical Activity and Sedentary Behaviour Guidelines for Ireland, you'll get directly to that point. And the guidelines themselves are based on a huge range of evidence and research. And I think that's available, Elaine.
Yes, the research report. So we've written quite a comprehensive summary of the research process that we went through. So that's also available on the UL repository. That's but the link to it is in the report that you'll download. So once you download the guidelines publication, it includes the guidelines, it includes the messages, it includes the messages for professionals and practitioners. And there's a little part that says further information, and you can click in there if you would like to, if you're someone who wants to look at the full research report.
And it also includes the links to those very detailed evidence summaries from the World Health Organization.
Yes, exactly. So if anybody wants to read more about the detail about, what aspects of health is physical activity impacting on, is it mental health? Is it cardiovascular disease risk? Is it your blood pressure, for example? You can read those evidence summaries. All the detail is available through the research report and in the guidelines.
Okay. So I suppose in summary, what would your key message be to the people who are listening today, to the policymakers? What is your elevator pitch in relation to physical activity? Might start with you, Sean.
Very good. It's probably going to repeat a little bit what was said, because I think what's really important is that people are engaging in activity that makes them feel good. Just like, you see a child and they're, jumping in puddles on the way to school because it just feels good. It's fun. And somehow we lose that as we enter adolescence, adulthood. We lose that sense of fun and enjoyment that we get just from moving our bodies. So I think from my perspective, it's about getting back in touch with that and engaging in a movement that just makes you, that's fun. It might be social. Some people, that's a very motivating factor. Just finding that and embedding it into your routine is key. Embedding it into your routine, and then you'll do it every day. You'll enjoy it while you're doing it, and you'll enjoy the benefits for years to come as well.
Charlie.
So I know that we've got lots of people online here, and it'd be part of their professional role to encourage physical activity. And I salute you, because Ireland's taken the bravest step. I think it's included for the first time globally messaging about physical activity, and it should be something to be massively proud of. But you're also all part of families, parents, carers, mothers, fathers, children. You're all part of your own social network. So spread the news throughout the social network. It's a weekend. I believe everyone's going to be gathering together. Let's spread the word about physical activity and perhaps have a Patrick Day's walk. That would be nice.
Colin?
Yeah, I think Charlie got touched on it there, that if you work within the physical activity space, you're cognizant of where the barriers to opportunities to physical activity are, and we all have day jobs with responsibilities to tackle those. But I think these guidelines kind of go a little step further than that, and it's try to, identify the hooks during your own day and during your friends' days and, your family's days of there's an opportunity to do something physically active here, and it can be fun, and I think this is the messaging in particular. I think in the guidelines are really useful. So I think it is that, there's a call for us all to try and proliferate these messages out through our peer groups, our friends, our families, and our jobs, and just try and, build that awareness of the importance of every move counting and do some. Thanks.
Elaine?
Yeah, I suppose I would love if, there's lots of professionals and practitioners at this webinar who are interested in promoting physical activity, which is wonderful. So I think it would be great if we all did see that as part of our responsibility. Whether you are the manager of a community-based childcare centre, or you are director of a nursing home group, that you see, I want, physical activity is part of my role. I want to encourage people to be physically active and to facilitate that in whatever is available to you.
Mm-hmm. Okay. So, guys, a slightly tougher question now. monitoring and evaluation. So it's great to have the guidelines, setting out what we need to do, how we should be going about it, the key messages to motivate us. How will we know whether we're making progress or whether we're shifting the dial in terms of physical activity across the population?
Sure. And I'm sure my colleagues can jump into, there are several surveillance systems, both nationally and globally. So we've had this slight, now for people working in this sector, the slight change in where I said an average of 60 minutes a day across the week for children. For those in surveillance, that changes the question being asked in population surveys and things like that. But we've had that language in the global guidelines since 2020. So, those conversations have been had, and we can, in Ireland, we can learn from how other countries and the WHO are now monitoring physical activity globally. So it's for the survey people to work out those nuances, but also I'd love if we also monitored the muscle strengthening components of the guidelines. Also, often we focus on how much general physical activity people are doing. It would be great if we could also comment on what portion of the population are doing muscle strengthening activities as well.
And what about sedentary behaviour?
Yeah. Well, we know for some time there's been general population surveys that ask questions about sedentary time. Often it's a general question around sitting time, but those methods are evolving quite quickly. There's an awful lot of physical activity and exercise scientists researching this area and are really interested in the nuances of sedentary behaviour, which we don't have in the guidelines yet. But I expect what will come will be, screen time, what kind of screen time, sleep as well. So sedentary behaviour can be quite broad. But with the guidelines are there, surveillance will follow.
So the guidelines, I suppose, as they're presented today, don't just present a challenge for us as individuals in being more active or, as practitioners to promote them, but also for the research and academic community in terms of how can we, I suppose, move forward the science of measurement.
Absolutely.
If I could just add to that as well, that now that we have persons living with disability included in the guidelines, I think it presents an opportunity for us as well to enhance our surveillance of physical activity of persons with disabilities who often are excluded from various data collection efforts. So I think now we need to follow up on these more inclusive guidelines. We need surveillance that actually does that extra little bit of effort to make sure that they are capturing physical activity and sedentary behaviour levels of persons living with disabilities as well.
Okay. And so if we're going to be inclusive all the way.
Exactly, yeah.
There is a question in relation to the change in terms of we're now talking about 2 hours and 30 minutes to 5 hours or 1 hour a day at least for children and young people. The World Health Organization guidelines uses minutes. I know if you do your maths, if you're good at mental maths, they're exactly the same. But why that change in these guidelines?
That was actually feedback from the public in the survey. One of the questions we asked was, okay, if we put 3 statements, 300 minutes, 2.5 hours, 2.5 hours, for example, with the various ranges for the different guidelines for the different groups. And we asked what was the preferred language. So that was one of the benefits from the consultation. It told us that just saying 300 minutes of activity per week, it didn't land well. People then have to, do a sum in their head. Yeah. So that's why we used 2.5 hours to 5 hours for our guidelines.
And I know that there would have been some comment on the previous guidelines, which were 30 minutes a day, and that mightn't have captured people that did their activity in different ways. So I suppose maybe these guidelines are looking at being a little bit more flexible and inclusive in terms of what people do and how people are active in our population.
Yeah, absolutely. The previous guidelines, I think, were 30 minutes, 5 days a week. And it's just the evidence has evolved now. As new guidelines come out, the scientific community is reviewing what research is out there and using the best available evidence to make their decision. And that's why we see that switch.
Sorry to jump in. So there was a tyranny in the previous guidelines, and the tyranny was the tyranny of the threshold. You had to get above a certain number of minutes for it to count. So epidemiologists love to put things in minutes because we can feel like we can control them and we can add mets to them and make them very clever. 150 minutes, 149 minutes, you didn't make the guidelines, 151 you did. These guidelines are different because all those minutes below 150 now count. Thank goodness we've finally caught up with where people really are. So the reality of putting it into hours and half-hour blocks is what people want to hear and what they're comfortable with. So let's start speaking to the experts who are the public. And these guidelines have done that, and congratulations. It's fantastic.
Australia, Colin?
Yeah, I think that's kind of half of what I was going to say, and it segues handily into the other half of what I was going to say, that when you look at what these guidelines do, they recognise that the health benefits of any move counting and of that range of time frame. They give you more information on the muscle strengthening versus the aerobic, etc. But I think as well, the examples they give a sense of the breadth of the types of things people can be doing in order to be physically active. And it's kind of on us then to look at our national surveys and our sectoral surveys to see how can we best capture that picture of how active our population is. Like, if everyone's on the 149 minutes before, you look like the worst country in the world. But on the other hand, you can kind of use this more holistic, this picture of, sorry, I seem to be making a noise up my mic, this clearer picture of what exactly is physical activity and the detail it gives on at what point people will start to experience health benefits associated with physical activity. And that's the stuff we really need to know about. And it'll be invaluable when we start to get the data back on this to inform policy development.
Welcome back, everyone. I'm really sorry. We just had a bit of a technical issue there. I hope you had the time and the presence of mind to stand up and stretch and move around a little bit while we were off air. Just as we were waiting to come back on, we were chatting here on the panel, and that concept of, things being within your community, that like you can get your shop or whatever, the 15, 20 minute community. Is that something we should be looking at? I think it is in one of the local authority policies someplace.
Yeah, I suppose there's a couple of pieces to it. Like it depends on the area, but there's, one of the big general directions of travel is towards, like you said, something that's within a 10-minute walk of yourself. Like we've got a program across the country where we're developing these walkways, and we've worked a lot with the GAA up to date, and we're kind of expanding where these walkways are that'll be lit, and will provide people with an option if they're in a rural area, in an urban area, that there'll be something nearby where you can go for a stroll in the evening, regardless of if it's summer or winter. You don't need to be looking at, all bells and whistles options within that kind of 20-minute radius, but it's what people have easy access to is what they'll end up doing. And, like one of the big challenges people talk about is the availability of time to be physically active. And if you can provide something that's a short stroll, easy to get to, you're out and back in an hour and a half, and you've got your physical activity in, that's a big barrier that you've managed to crack right there.
And given that we have a cohort of really well and distinguished exercise scientists and specialists sitting here, is there anything we should be looking at in terms of our physical education curriculum and approach here in Ireland?
Well, actually, we've seen remarkable changes in the physical education space in recent years. We have a new junior cycle curriculum, we have a new senior cycle framework, and of course the introduction of Leaving Cert physical education. So I would say the physical education teachers across the country really have been leaders in that space, taking on new curricula, new developments. And at the moment, there's a consultation on the new wellbeing curriculum, which includes physical education at primary level. So I would love if, like what was happened in post-primary, that if when this new curriculum at primary level comes out, that it's in service and additional professional development is made available to primary school teachers so they can maximise the additional time that now is going to be given to primary level physical education, which is excellent. And then outside physical education, of course, there's lots of physical activity opportunities throughout the school day. There's some brilliant initiatives, and from various schools really champion that, being physically active for everybody, both the brilliant sports teams they have, but also being just generally active throughout the day, before, during and after school. We're through things like the active school flag at post-primary level. We're actually seeing a lot of initiatives and a lot of movement in that space.
Great. And I suppose, just as you're talking about practitioners and training and resources and stuff like that, in terms of these guidelines themselves, the resources that will be available for practitioners to, I suppose, take them on board and maybe communicate them wider, will have the guidelines on the website. We'll have a summary of your presentation, Elaine, available for people. This webinar is recorded. There'll be a suite of infographics as well to support it. And Colin, as you were saying, as the work with the various different sectors rolls out around the new National Physical Activity Framework and Action Plan, messages, resources, supports, training and pieces like that will
be targeted
and will develop over time. So I suppose just to say thank you very much to every one of you here today for your time, your energy and your insights. It was really, really interesting and wide-ranging discussion. Thank you very much to everyone online who joined us. I hope you found it really interesting and as exciting as we all did here. So I would encourage you to get up, get moving, and thank you very much.